Hello and welcome to the Technology, Risk and Gambling Seminar Series. I'm Sally Gainsbury. I'm a professor in the School of Psychology at the University of Sydney, and I'm director of the Gambling Treatment and Research Clinic within the Brain and Mind Centre. Today, I'm really excited to have Chris Boyd-Skinner, who is someone I've been wanting to chat with for a while now. Chris works in the public service and he's a digital mental health consultant. I'm going to, Chris, ask you to introduce yourself and your background because it's a field that, although every Australian and most people around the world are aware of and know that this exists, they probably haven't thought through a lot of the implications that your everyday concerns with. So I was hoping you could run us through, how do you describe what your role is to people when they ask you?
Yeah, thanks so much for having me on the show today, Sally. It's a real privilege, and again, I've been looking for an opportunity to have a lengthy conversation with you. So this seems like as good an opportunity as any. So yeah, I'm Chris Boyd-Skinner. I currently work in the Australian Public Service as a director in clinical governance, and I've been working in the APS for the better part of a decade now. But my background is actually in healthcare. I'm a registered nurse by trade. And most of my clinical experience has been in intensive care nursing. So I'm from Wollongong originally, but I moved up to Sydney to do my degree, and I worked at St Vincent's Hospital in Darlinghurst in neuro and trauma intensive care, which was quite an interesting way to start my career, and saw some pretty incredible things over the course of those few years working at St Vincent's. But then I went back to uni and studied a public health degree. Got particularly interested in international public health. Spent a little bit of time working overseas, did an internship with WHO. And then when I came back to Australia, I kind of fell into digital health by accident. I got a job at the Australian Commission on Safety and Quality in Healthcare, who are they're a government agency, but a standard setting body. And I was working in the digital patient safety team there. And that's kind of where I really fell in love with all things digital health. I guess off the back of that as well, as a kid, I was always really interested in science and technology and space. I guess like kind of every young kid, and sort of consider myself to be a little bit of a futurist as well. So working in the space where I could think about really cool types of technology, but also how to deliver them in a safe and high quality way, it's really been quite a nice match for me. I also do a little bit of work as a consultant for World Health Organization. So recently I've been working with the WHO Athens office for quality of care and patient safety. And with the team there, I've been doing some interesting work around standards for child and adolescent mental health, and thinking a little bit around what some of the safety and quality provisions are for using digital mental health technologies with young people. So that's been a really interesting piece of work, and we hope that it's going to be quite transformative to some of those countries in the European Union that might be coming off a little bit more of a lower base in terms of their approach to clinical and technical governance for child and adolescent mental health services.
Thank you for taking us through that background. Funnily enough, my first clinical role was also at St Vincent's. I was working in the drug and alcohol clinic out the back in an old terrace house that we had people detoxing in. So funny paths aligning. Look, I want to paint the scene for people who are listening. We have a lot of people listening who do provide treatment, who provide clinical care in various different guises, psychologists and people in community organisations. We also have policymakers and people in the gambling industry. And I think this idea of digital health, and it was really nice you finished on that idea of lifting up a diverse array of countries and jurisdictions, because technology is one of those things that is quite translatable, and you can ramp up other countries pretty quickly because you can have we all mostly have access to the same technology. It's the skills, I think, that maybe people don't necessarily have. So one of the reasons I wanted to chat with you, and just to paint the picture of how it intersects across different fields, is within gambling we have obviously treatment and increasing use of digital mental health, and both guided digital mental health with clinicians involved, as well as self-paced digital mental health for people who are trying to struggle with gambling problems, or other related mental health issues, or they're trying to prevent gambling problems. So we use, digital tools for a preventative and educational purpose. We also have a lot of tools that are now online, things like the ability to self-exclude from gambling venues or operators. And within operators, we have things like being able to track how much you're spending or set limits. So using digital tools, and we're increasingly looking at digital payments as well. So people actually making transactions online with digital currency. Now, there's a lot of different ways here that I think what we can learn from aspects of technology, trust, what consumers use, what are the safeguards for consumers, how do policymakers think about these things, and one of the, obviously the stigma and the barriers that people have. So there's lots of that we can learn from you in your experience, and of course then all the other digital issues in behavioral addictions like gaming problems and things like that as well. So maybe you could paint the scene for us and thinking of what are really the key issues or the types of issues that when you're looking at policy around digital health, from a government point of view, from a technology point of view, and I'm really interested in the consumer perspective there as well.
So look, I mean, government largely has, a pretty substantial role in this space in terms of sort of setting the policy agenda around safe and responsible use of online technologies. And if we think about the ways in which they do this, we've got a range of different legislative instruments. So think things like the Privacy Act, for example. We have standards, both technical and clinical standards, guidelines, and government also has a role to play in the context of education. So kind of framing that in the context of digital health literacy. I think the education piece is really quite important, particularly in that context of privacy, because we really need to be educating providers who are delivering these types of tools and designing these types of tools to really bake privacy in, privacy provisions in from the outset. So that means, good privacy, but also good cyber and information security management practices. And I think if we do that from the outset and encourage and educate to do that from the outset, then we're kind of going most of the way in terms of reducing the risk of harm to people when they're engaging with digital tools. On the other side of the equation, from an education perspective, is thinking about digital health literacy from the consumer's perspective and the carer's perspective. If we can slowly get to a point to moving the dial on that spectrum of digital health literacy for consumers and carers, again, we've got a much more aware population who look at risk when engaging with online technologies in a very different way. What we really want to see is a society that understands what the risks are associated with engaging with online tools, and that could be anything from just engaging with the internet as a basic level, but also more complex types of technologies like digital therapeutics, for example. Understanding what the risks are, importantly, understanding what they're signing up to when they choose to give their data over to an organisation, and really get a good sense of what that risk versus benefit type equation looks like.
That's a really good answer, in the sense that I think it's so interesting when people think about risk, and also technical competence, and maybe that's something to just get out of the way, is I believe we're seeing an increase in technical competence. So when we talk about digital literacy, it's probably the bar has been raised. Most people can probably use a smartphone, can use a computer, can use the internet. There is always this equity divide when we talk about access to technology and access to high-speed internets. But, I think that's it's becoming a reduced issue, but still one we need to think about. But is there a point at which there is sort of a tipping point? We've done some research just recently where we found that smartphone use was fairly broad, online banking was fairly broad, but the tipping point that we found was the use of a digital wallet, so people actually making payments. In healthcare, is there a similar tipping point where people are generally okay to, sign PDFs online or use their emails? Is there a tipping point when it comes to maybe like creating an account or more sophisticated use? Where are you seeing the divide from where it was to where there starts to be more of a technical leap that people need either practical assistance with, or is it a practical assistance to learn it, or is it more of a cognitive, thinking it through? Where's the divide now?
Yeah, I think it's probably a combination of both of those things, both the practical and the cognitive aspects. And if we think about where we were pre-COVID in terms of the utilization of things like telehealth, we've just had this extreme quantum leap in terms of the level of adoption and uptake. I mean, prior to COVID, it'd be relatively rare that you would have a telehealth consultation with your GP, but now it's basically offered to you when you go through a booking engine when you need to see your GP or a psychologist or whoever the clinician might be. So I think there's been a pretty seismic paradigm shift in terms of people's attitudes towards using digital health technologies. But in the context of literacy, I mean, we do see pockets across the age spectrum. If I think about my parents, for example, they both know how to use a smartphone. They both know how to use Facebook. So I don't necessarily think it's the device use. I think it's getting people to a point where we have a bit more of a deeper understanding of what the risks and issues are associated with handing data over, for example. So educating them about being cautious in the context of reading a privacy policy, for example, and really trying to get people to be a little bit more aware of what they're actually signing up for when they engage with these types of tech.
Yeah, and I think that's super important. We know that online scams are, beyond rampant. They're costing so much money and causing so much heartbreak for people. And I think that's a really interesting point, because on one hand, we're trying to encourage people to use and trust appropriate tools. So we're trying to encourage people to share their data, with respected and reputable resources. But we're also teaching people where the line is and how to be really careful and then not scare them. So I think it would be a very difficult public health challenge of how to structure that communication, say, don't share anything, don't give anything away, except for with us, because we really do. It's much easier to do your Medicare online. So how do you structure that conversation when you really need such a fine line for people?
Yeah, it's a really interesting scenario that you put forward. Yeah, particularly that we want people to engage with the national digital health infrastructure, because we genuinely believe that there are some pretty significant benefits with having a connected healthcare system. But at the same time, we also want to have that level of vigilance where people who might be engaging with other types of tech that do nefarious things with data, we want to have that level of vigilance very well embedded across society. Something very interesting that was developed a couple of years ago by the World Economic Forum was something called their Digital Trust Framework. And I think in Australia, we could absolutely benefit from having something similar. So World Economic Forum work with a range of different partners from around the world. And they put together this digital trust framework, which focuses on like three key pillars. So the first is security and reliability. So thinking about how we encourage a system that's secure to interact with and also presents a good sense of reliability in terms of its ability to be able to provide consistent services. Thinking about accountability and oversight, so who is accountable for that particular piece of technology and what governance mechanisms might they have around it to ensure that effectively they're playing by the rules. And then the third paradigm was in inclusiveness, ethics, and responsible use. I think government and also policymakers have a really important role to play in that third pillar. We want to ensure that we are designing systems that are inclusive. Obviously, the ethics component of it is extremely important in terms of driving trust, and the responsible use as well. And I guess to an extent that kind of falls back to the consumer and carer side of the equation, but also that is very much married up with the idea of having sufficient levels of digital literacy to be able to make informed decisions that then flow into responsible use. So I think Australia, we have a relatively mature level of digital literacy. We do have some way to go in comparison to other OECD countries, but I think starting to perhaps think a little bit more clearly about how we embed trust in national products and national services is really quite important.
Yeah, and I think One of the areas I'm keen to get into is what we can learn from various different stakeholders. And I believe you've got some knowledge around the Mozilla Foundation's exploration of privacy of users interacting with apps. I was wondering if you could take me through what you know about this experience and what we can learn from it.
Yeah, absolutely. This is a really interesting piece that the Mozilla Foundation did. I guess by way of background for your listeners, the Mozilla Foundation is linked to the web browser Mozilla, which some people might be familiar with. And their project called Privacy Not Included came about to help consumers make more informed decisions about the privacy and security of different products that are connected to the internet. So things like toys, games, and apps. And I guess also the project was off the back of some growing concerns about how personal data is handled by different technology products, and especially those that are connected to the internet. So back in 2017, the foundation had the goal of setting up like a buyer's guide to help people and consumers shop smarter for those internet connected products. And they also recognize that by and large, it's quite difficult to get really clear advice about what the privacy aspects are of particular products. So they went through a process of basically doing a huge, large scale analysis and some extensive research on a wide range of products, and it included things like smart home devices, fitness trackers, and importantly, mental health apps as well. So they did a bit of a deep dive to look into their privacy policies. They looked at their websites, they looked at news reports, they looked at consumer reviews as well for these products to see if there were any privacy or security concerns associated with them. And then based on all that information, they set up like a criteria. So they looked at things like data usage, user control over data, and then also the company's track record in protecting user data as well. And what they found was that a lot of these products, quite a high proportion of them, had actually very poor privacy practices. So, for example, some products collected much more data than was actually necessary to have someone opt in to use the product. In a number of cases, what the Mozilla Foundation discovered was that organizations were selling user data to third parties, which is particularly problematic. And there was also, on a number of occasions, a lack of a clear mechanism for users to be able to actually opt out or delete that data. And again, that's quite problematic because effectively as consumers, we should have a choice as to whether or not our data is used and for what purposes as well. So I think the findings really highlighted that even some very innocuous type apps or connected products are not doing the right thing when it comes to handling sensitive information. The other example that I'll give is just in relation to a couple of the mental health apps that were involved in this deep dive into privacy. And a number of the ones that Mozilla reviewed were found to have been sharing really sensitive data with third parties, including advertisers that would re-advertise back to people who opted in to share their information. And I think mental health data, the old adage that it's probably the most sensitive or highly sensitive and personal information that you can find in the healthcare space. Sharing that without explicit consent really does violate in so many ways the user's privacy. And that in itself can be one key mechanism to lose the trust of people using digital health technologies.
Yeah, and I think it goes back to this idea of what's free. And really for consumers, one of the key points might be to think about who is actually paying for this product. If there's not, if there are an explicit cost to which you're paying, that's probably your best case because then you know where the money's coming from. Or is it government sponsored or a charity sponsored? So there's a very clear mechanism. But if it's not costing you anything and there doesn't seem to be an organization or charitable or a government organization behind it, then there is money being made and it's probably from you. And best case, you're just getting it by viewing ads, but more likely your data is being sold and, and then some. So it's really getting people to think, Facebook is not a social network, it is an advertising site. Same with Google, these are not organizations that exist to benefit you other than to make money from you. There's a reason they're making money, and for people to sort of think through that, I think is really important. And I wanted to get your perspective is, are there different groups of consumers? Obviously there's going to be a broad spectrum, but are there buckets or chunks that we can put people in? There are some people who just, I'm thinking you teenagers, signing up, downloading, putting their naked pictures online, just like totally not thinking through. Then there's going to be another group of consumers that are just like not on anything. They're very, very sensitive, and then presumably there is sort of a few groups in the middle that are more selective. They'll use government tools, they won't use commercial tools, or people who are more sensible. Is there different ways in which you sort of chunk people? Because what I'm thinking about is to encourage people to use the tools we want them to use, the Commonwealth health tools, maybe, a local government self-exclusion app. How do we target different groups in different ways?
So look, I think you're absolutely right in terms of chunking consumer groups out into a couple of discrete buckets. I think the important thing is understanding that those differences exist and they are real from the outset. And with that, we need to think very carefully in terms of communication, tailored communication for all those different audiences. Of course, the example that you gave there about adolescents and youth and teenagers engaging in social media and other types of apps in a way that they might not necessarily think of the consequences. So too do we see people from older age brackets doing similar sorts of things, just because they don't really have a deep understanding of what the risks and consequences are. So I think coming at it from a number of different directions, having really carefully considered and tailored messaging is important to ensure that we capture all those different pockets of consumers and carers as well. And if we think about some of the work that's been done internationally in the context of misinformation management, I know WHO have got a really significant project at the moment looking at mis and disinformation. It's often a good way to sort of come at it, because they're thinking quite strategically about different pockets of society and how they might tailor messaging to ensure that they can tell the difference between what might be a fact and what might be a fabrication. I think absolutely a similar sort of approach applies to thinking about how we communicate the risks associated with engaging with online tech.
And the way that we originally connected, Chris, is through the Churchill Foundation, the Winston Churchill Foundation. You are a recipient. Was it 2023?
2022, and then travelled in 2023. Yeah.
Excellent. So the Churchill Foundation is a fantastic organisation in Australia that funds travel overseas, recognising the role of the characteristics of Sir Winston Churchill, to his continued desire to learn and to improve his own knowledge, and to importantly share that knowledge as well. So the Churchill Foundation is a vehicle by which prominent Australians can travel overseas or travel domestically, but meet and learn from others and bring that knowledge back to further the work that you're doing. And I think that's such a great example, because what I really want to talk about with this idea of, what have you learned from other jurisdictions? What are the mistakes that Australia can avoid? What are the examples that we can aspire to? Obviously, there are cultural differences, and maybe that's something you can talk to as well. What's unique about the Australian population? There's a lot there. So I'm keen to hear what you've learned from your experiences.
Yeah, absolutely. And look, maybe just to pause for a moment and congratulate you on being a recent recipient of the Churchill Fellowship. I was super excited when I saw your name on the list, and yeah, no doubt, like my experience, you'll just have such a wonderful time traveling around the world and meeting wonderful people. So congratulations,
Thanks,
first
Chris.
up. So my Churchill Fellowship was around looking at safety and quality in digital mental health, and I pulled together the pitch, and I was at the time really interested in some of the stuff that was going on in the digital therapeutic space. So for those of you listeners who aren't familiar with that type of technology, it's kind of like super apps effectively, and they almost work a little bit like a digital medicine. So if we use mental health, for example, these are clinically validated online platforms or apps used to treat and manage, say, for example, depression or anxiety. So they have a really high level of clinical evidence and clinical backing. They have the ability to be able to demonstrate real world outcomes and can produce data to that effect. And so at the time, I was doing a lot of reading around how digital therapeutics were being prescribed to patients in countries like Germany and France. So I did travel to 7 different countries through my Churchill Fellowship, including the United States, where I met with some policymakers and a couple of think tanks. I spent some time in Norway, and I'll get to Norway in a moment because I think it's a bit of a standout in the context of all things digital and interoperability and trust. I had a wonderful week in Copenhagen where I met with some colleagues from WHO, conference in Portugal, and then I had a week in Switzerland, a week in France, and then 10 days in Berlin. So about 6.5 weeks of travel in total. I conducted something like 32 interviews, so a couple a week, and tried to find a little bit of downtime to keep on top of writing my report, which is one of the requirements when you get home, is to submit your findings and think about an implementation plan. But I think one of the most interesting things I found from Scandinavia in particular was that their level of trust in government is like supremely higher than many other areas of the world. And when you have really, really good trust in government, and we all know that Scandinavia pays pretty high levels of tax compared to other parts of the country, other parts of the world, I should say. When you have these high levels of trust in government and you have expectations from society to be able to deliver goods and services to their citizens that meet their needs, generally that's a little bit of a ripe ground for the willingness of citizens to be able to share their data with government and provide them with good technology and good services to make healthcare basically seamless. So using the example of Norway, they've got interoperability sorted out. So, but what I mean by that is that there's a fully connected healthcare system. Your doctor and your hospital clinician and your allied health clinician can all basically see the one patient record. They all know what's happening. It's extremely beneficial in the context of continuity of care. And it just is a really nice experience as a consumer to be able to go through their healthcare system, because everybody knows where you're up to in terms of your patient journey. We're not faxing information from one provider to another. It's effectively like a single door front entry into their healthcare system in an online environment, and everything from social services to healthcare information to booking transport to get to a hospital is all sort of done within one platform. So I think it's a really good example of where trust has kind of been the driver for promoting a really rich and extremely efficient digital health ecosystem.
I think that trust has to be the driver to some extent. So obviously I'm a psychologist, so consumer behavior is an area that I'm very familiar with. And although we have seen stigma reduce towards a lot of health and mental health issues with gambling, there's still a very high degree of stigma. So people are very reluctant to have any kind of record of them having a gambling problem, which makes it really problematic if we're trying to encourage early intervention and preventative care or engagement with resources, because no one wants someone to think that they have a problem with their gambling. There is a concern that if there is some sort of problem, or if there's a perception there's a problem, they might be restricted or shut off, or their accounts will be shut down, or there's a high degree of denial that people say, oh no, it's it's not problematic. That really we see people until it reaches a crisis point. People are very reluctant to think that there is something that needs to be done. So would you say Australia has a greater degree of stigma than some of these other countries? And I don't know if you have any comments on how it could be overcome, or whether there's any differences between the population groups.
Yeah, so look, I mean, stigma across the spectrum of males and females, I think differs from country to country. And I think in Australia, we certainly have a problem with mental health stigma, and particularly in young men. What I would say in relation to stigma, I guess just as a grounding comment, is that this is why digital mental health tools could be so appealing to people who are a little bit concerned about exposing their their information and background to whether it's a mental illness or whether it's a gambling addiction, because they really do offer quite a unique vehicle for anonymised care. And I know that in consultations that I've had in the past with consumers who have been users of these types of technologies, they always say that I love to be able to log into a forum or to an online CBT course using an alias or a pseudonym, because I don't have to be identified and I don't have to worry about that being recorded anywhere. So I think it's really quite a good opportunity for people to be able to engage in good, well-tested and clinically validated care for their mental ill health in a way that suits them best. And I think this is where digital mental health really shines, and we're seeing a lot of examples of these types of tools pop up across Scandinavia and being embedded in this national platform, for example. So you can go on there and jump into a chat room or use a chat bot if you're a child or an adolescent. They've got other types of products for people that fall into the adult category. And you can do it all anonymously. And I think that that's a really nice way to approach people who might have a mild to moderate, generalized anxiety disorder or depression or whatever it happens to be, because it does allow them that opportunity to be able to jump in and do it in an anonymous fashion, hence reducing that idea of stigma.
Yeah, and that's a really important way of trying to overcome some of these stigma, and I think increasing people's comfort. A lot of the time people have a fear because they haven't engaged with it before, and potentially allowing the initial stages, or you can do this percentage without providing any details. But as you know, with healthcare there is, and with government policy, there is sometimes the need for tracking. So we've obviously you've already raised the example of QR codes and COVID, where people had to sign into venues. Look, and when it came down to it, people did it. They didn't seem to, like, obviously there were some people that didn't want to, but by and large people agreed, and probably because they understood the purpose. They recognized the need for it as a community-based, it's bigger than just me. But now we've kind of gotten to, are we in post-COVID? Who knows? Anyway, people are now starting to be more mindful again of is this benefiting me, and I think you kind of attenuate to that and decide, oh, actually I'm more important than the population and community after a while. So there still are some programs that require people to share their identification. For example, if we're doing account-based gambling, if we're doing self-exclusion, it is based on an individual as opposed to an anonymized account. Even things like anti-money laundering. So how do we overcome stigma and resistance to data sharing when you do have to share your identity, even if there are safety protocols built in such that, for example, the government can't access it, even if it's just that perception that, well, I'm sharing my data with the venue and so the government might be able to access it. Are there ways to mitigate this? For example, if the University of Sydney offers a tool, is that better than the government health department? Is an individual sort of venue level trusted more than a government? How do we mitigate some of these concerns when there is personal data being shared?
Yeah, so I think there's a couple of things in that question, Sally. I think probably the primary thing is being as transparent as possible about what you're going to use the information for. And it reminds me of an example from Australia's digital mental health standards. One of the requirements of those standards is to actually have product information. So if you think about when you go to the shop and you buy a packet of Panadol, you take out your Panadol and it's got that little leaflet in there and it tells you about, the pharmacovigilance aspects of paracetamol. The recommendation in the standards is to do exactly the same thing for tools and products that get accredited to those standards. So you kind of need to articulate what it's for, what's its intended purpose, what are the risks, what are the intended benefits, and what do I do if I need more information? And I think kind of using that as a template to draw that level of visibility to what the actual product is claiming to do is a really kind of unique way to get people comfortable with the idea of what they're actually signing up for when they engage with any type of digital technology. So I guess transparency is probably one thing there. And then, again, deviate back to the idea of education as well. We need to have people develop a really deep understanding of what digital health can do, what it can offer, and again, really trying to highlight what the benefits are.
Yeah, I think that's really important, though, is that two-pronged approach. And I guess it comes back to implementation, that we can have something that works. If no one does it, it's that kind of tree falling in the woods example of does it work if no one uses it? If we can show in clinical trials it's effective, but then we launch it into the real world and no one uses it. And I think of the example of one of the first examples in gambling of a sort of account-based play was in Nova Scotia in Canada, where they did several trials. I think it was 3 trials, and they had some really good designs. They had a trial where they actually had a town that was kind of sectioned off, so they almost had like an island trial. They did all the best practice methodology towards implementation, and they finally rolled out this technology and no one used it. So then they did more focus groups, and they found all these privacy concerns. So then they put up posters in the venue, which kind of to me sounded like Big Brother, trust us, the government isn't watching you, which I think just made everything worse, and they ended up having to pull the technology. So I guess what I'm trying to say is it gets to really, and maybe you can tell any examples or where you've seen this done well, the extent to which these concerns have to be investigated ahead of any implementation or launch, and the importance of getting in front of consumer concern. Is there one of the original sort of arguments against safe sex, oh, don't say anything, because if we don't talk about sex then maybe they won't realize that's a thing. Is there a similar concern if we don't raise the concerns before, people won't have them? Or how important is it to understand what people think about it, or where people, what people come up with, and get ahead of that in terms of communication?
Yeah, look, I think that approach that you described about sticking your head in the sand is not going to do anyone any favors. It's almost like ripping the band-aid off and having a pretty honest discussion about digital. I think that's probably the safest approach. Look, I think what it really boils down to is thinking about consultation and making sure that we're getting in front of the people and listening to the people that are going to be the end users of these products. I mean, there's other things that we can do in terms of sentiment tracking, which is a good way to sort of get some data around what people's attitudes are towards technology. But I think whether it's a policymaker or a government agency or a developer of a digital tool or service, that ideation phase, when we're thinking about actually building something, what do people actually want? What's going to make them feel comfortable to engage with the technology? Where do their fears lie in terms of concerns around data, or where that data is going, who's going to use it, where's it stored, is it onshore or offshore? So I think having some really frank and open discussions, using focus groups and other consultation mechanisms from the outset before we even think about designing something is really very critical to ensure that we can get a deeper understanding of where people's heads are at.
Yeah, I think that's really, really important to over communicate the benefits for the user, for the community, because people often, we find people are more willing to do something if they can see the benefits for others and it's really clear to them. And that gets to that idea of design and making it clear and simple, and that people, and transparency, all the principles that you've talked about. And I wonder if we can circle back to that idea of the equity divide and inclusive technology use, because there are going to be different levels of technological literacy and comfort and access. Coming from obviously a Commonwealth approach, you need to ensure that every Australian can access technology and the solutions that you build. And there are going to be some natural pain points that you can't overcome. If you need a QR code and you don't have a smartphone, how do you think about equity, and how do we even design wise, what's the best practice?
Yeah, so look, I mean, the first thing to think about is the infrastructure, right? So government largely has quite a strong role to play in terms of facilitating the ability for people to be able to connect to the internet. And when I think about that, I immediately think about folks that are living in rural and remote regions. So without a stable internet connection, access into digital health technologies is, you can kind of throw that out the window effectively. In the context of smartphone use, I mean, obviously there is a divide there, but predominantly many people do have access to that type of technology. Not everyone. So there's that, I guess, the device and ownership and the ongoing maintenance of cost. So that also sort of plays into that socioeconomic argument as well. I suppose the other thing that I think about is the the makeup of Australia's population in terms of the number of people who come from overseas and also might come from a non-English speaking background. And to me, that's probably one of the greatest opportunities, particularly with the advent of generative AI. We've got Gen AI products now that can do real-time translation, can translate whole apps into different languages. I think we really need to start thinking more innovatively about how we harness artificial intelligence to be able to scale up and make these products more accessible to a wider range of the Australian population. And I did see a good example from some folks at a company here in Sydney in Surrey Hills. They're called Cognos, and they use no-code or low-code technology to be able to build apps in really, really quick time. So I think the most recent one they did was building an app for a care pathway navigation for people with bowel cancer, and they built it in 6 hours. Within that 6 hours, they also managed to translate predominantly most of the content, the base content in the app, into Hindi. So I think we really can look at that equity picture and think about what opportunities we have with artificial intelligence to be able to make these products more accessible and therefore more equitable to a larger slice of the Australian community.
Yeah, that's a great, wow, that's incredible. And I'll just mention to anyone who's watching live, feel free to pop any questions in the chat because I'm going to keep going. Otherwise, and the fact that you brought up Cognos, and that's an interesting one because I was thinking as you were talking, I just yesterday was at a student showcase of undergraduate students, and they each had different projects, and 3 of the 6 projects were on AI. You know, one was on anti-vaping, one was on using Gen AI as a teaching tool for students, and another is a teaching tool for medical professionals. So, you know, we're exploding in terms of this interest in AI. And as you mentioned, you know, that rapid iteration, I've personally found, no offense, working with government pretty slow. You know, it's a slow process, but there are organizations out there, there are research teams, or there are companies or nonprofits, or lots of different stakeholders. You know, how do you see that approach of what are the roles that different groups have to play, whether it's we don't want to reinvent the wheel, so we don't want everyone doing necessarily the same thing, but is there a role for, say, universities to be coming up with these like partnerships? What's the best approach, or what are some of the examples in which you've seen, you know, good things come out of, especially when we think of the need for evaluation and also iterative evaluation, because we've already talked about how in the last, you know, 3 years, technological, you know, I think you used the word quantum leap. So, you know, you can't just launch something, even if you do evaluate it, and then leave it. Or, you know, what are the role for different stakeholders to push some of these technologies?
Yeah, so I think in the context of government, the best role that they can play is designing the right policy environment for these types of technologies to flourish. And if you think about a couple of examples that I've seen overseas, in Germany, for example, they're quite at the forefront in terms of digital therapeutics. They've got really strong partnerships between industry and government. There's a really strong dialogue between both of those pockets of the sector, and that's made for a policy environment which is really ripe for innovation. And with the right policy settings, I guess what I'm trying to say is with the right policy settings, government can play a really strong role in terms of in supporting and driving innovation. I guess also with funding mechanisms attached to that as well. Sometimes it's a good idea to be able to have some dollars attached to driving innovation as well. And I think that's something that we've seen become more commonplace in the last couple of years. Yeah, some of the best products that I've seen in the context of digital mental health have very much come out of tertiary education institutions and the research arms that are attached to those. And particularly what we see in terms of uptake of those types of technologies, if there's good evidence that's generated to really put some visibility around the fact that these things work, I think they're more likely to be used and adopted by consumers. The 2 other pieces of the equation are clinicians and consumers. And clinicians are a really important part of this conversation because we need to get to a place, if we want to see better uptake of digital health technologies, we need to get clinicians across, again, what the risks and benefits are and opportunities are for these types of tech. And also getting them to actually sit down with a consumer and think about, well, how can I prescribe this to someone? And again, thinking about my experience over in Germany and France, they've got a program there where you can go into your general practitioner and you can be prescribed a digital therapeutic for a 6 or 8 week course, and it's reimbursable under their national health insurance scheme, kind of similar to Medicare. And it'd be wonderful if we could kind of move the dial in Australia towards that direction, because we've got lots of issues around workforce, whether it's in the mental health space or otherwise in acute care or aged care. And kind of, I think there's a really ripe opportunity there for digital health to kind of take some of the pressure off a really kind of a struggling healthcare system.
Oh, so much so. And I think though, I wonder if people get a little bit afraid of this slippery slope. And you're right, now people are totally comfortable with telehealth consultations for some things, but not for others. And I think of, I mean, I can't remember what movie I've seen it into, but essentially you walk into, and a hologram asks you questions and, you never interact with a doctor. So I think there is some concern of how far, where is the divide in which you need professionals versus you need Gen AI. But what do you think are some of the main barriers? What needs to be overcome from a systemic point of view, whether it's training or technology or consumer adoption? Where do you see some of the key barriers that need to shift at this point in time to progress some of the ideas and potential applications of digital health?
Yeah, so thinking about the government perspective, I think the economic argument needs to be made about what economic benefit digital health technologies make to the bottom line. So if we're thinking about investment and policy to drive the use and adoption of digital technologies, then the economic argument needs to be there. It needs to demonstrate that it's going to reduce the bottom line. So I guess from the government perspective. From industry's perspective, again, the regulatory and policy settings need to be adjusted in such a way that there's not too much red tape for people to enter into the market. Anecdotally, I've heard that there's some jurisdictions around the world, including Australia, where it is a little bit challenging to navigate the regulatory environment. That said, it is set up there to ensure that any product that is listed on a therapeutic goods register is safe and high quality and appropriate for use, depending on what the application is. So there's two sides of the equation there, but getting the regulatory settings just right to ensure that there is a relatively non-resistant path to getting a product to market. From clinicians' perspective, I think, again, going back to digital health literacy, we've got clinicians that sit on both ends of the spectrum in terms of both their knowledge and understanding of digital health, but also their willingness to actually use and adopt in practice. And I guess not to pigeonhole anybody, but clinicians that have sort of been in practice for quite some time might not necessarily have the same approaches towards using digital health as a mechanism and sort of prefer that face-to-face interaction, whereas other clinicians that might be quite new to practice, growing up in an environment where technology has been very heavily embedded in their lives from an early age, might be a little bit more open to trying new things. So yeah, I think it's a combination of all of those things that are going to be really important in terms of driving uptake of digital health technologies in the future. We're absolutely not there yet, but I think definitely in the last 5 years or so, we've made some pretty significant gains to sort of getting towards that point.
There's definitely been huge gains made, so I have no doubt that we'll continue to use that and people will become more comfortable with it, likely. But we know that this happens, that there are cyber criminals, and we've seen in Australia some pretty high level data breaches from some fairly major organizations, which is certainly hurting consumer trust. I struggle to believe it's possible to ever make a system completely foolproof. We just don't know the range of expertise out there, and probably it's more on the dark side than on the good side, unfortunately. So we will continue to see attempts and some successes in terms of privacy breaches and technical breaches. What's your advice in terms of this for consumers? How do you think about this potential outcome that there could be a breach somewhere?
Yeah, look, I mean, I think unfortunately, it is inevitable that this will keep on happening. I don't think it's going to go away anytime soon, which is a little bit of a stark reality. From a cybersecurity perspective, healthcare is considered to be a pretty ripe picking ground because we've got some, as I mentioned earlier in the discussion, we've got some pretty sensitive information that's quite lucrative to cyber criminals. But I think from a consumer's perspective, it's engaging with resources to give you a good sense of how to operate online, and also that education piece around understanding what might look a little bit not quite right, and using your gut to be able to potentially say no, or not click on that email, or not engage with the conversation that somebody that you're not familiar with that could be trying to extort you for whatever reason. And then, as you mentioned, the significant breach of Medibank that happened, 9 million customers, pretty astounding and transformational. So, I mean, in an ideal world, we would want to be trying to stop those sorts of things. For the provider side of the equation, I think there's some really great resources that have been developed by the Australian Signals Directorate and also the Australian Cybersecurity Centre. So when designing products, thinking about the essential 8, so there's sort of like 8 different aspects to ensuring that you've got good cyber hygiene within your products. And then other resources like the ISM, for example, which is all around, it's practically a handbook for information security management. I think one other thing that's quite useful is for organizations to think about what their technical governance policies look like, or technical governance frameworks. Kind of similar to the space that I'm working in at the moment in clinical governance, where we think about clinical governance as kind of like that whole of organizational responsibility, from the board right down to the people who are actually delivering care on the ground, really getting a clear understanding of what their roles and responsibilities are in the context of safety and quality of care. Technical governance is pretty much the same sort of concept, in that anyone who's involved in a technical nature within an organization has a clear understanding of what they're responsible for. And if you can kind of map that out and articulate it really clearly, we've seen some good evidence of those organizations being prepared to respond to breaches, being prepared to respond to other cyber incidents, and also having products and services that really do encapsulate privacy as one of their core principles. So I think having that structure, having that rigor around the product really does go some way to ensuring that people who are interacting with your product are generally kept safe.
Yeah, like that's a really good run through for everyone. Thank you. Look, as we're coming to the end, you're at a lot of conferences. I know you travel a lot, and in your role, you're exposed to a lot of really exciting concepts. So I was hoping you might be willing to share with us what the future looks like and some of the things that are in the pipeline. Domestically, we obviously got to have a large international audience as well. What do you think the future looks like for digital health, and what are some of the exciting innovations we can, whether dream about 20 years from now or think about more practically in the next 3 to 5 years?
Yeah, excellent question to round out the conversation. I think in one word, exciting. It's a rapidly expanding field, and I think we're in a bit of a gold rush period for digital health at the moment. Everyone seems to want to have a bite at the cherry, and I think that's really exciting, so long as it's being done in a safe and responsible way. I think we're also kind of seeing ourselves at the top of the hype cycle for generative AI at the moment, and I think we'll probably stay there for a little while. I think probably one of the most exciting things for me is thinking about that concept of personalized medicine. So using artificial intelligence to really tailor specific treatments depending on what someone's condition is. Thinking about using big data to analyze genetic information, information from electronic medical records, family history, all those sorts of things, and all the millions and millions of data points brought together to really tailor and personalize a treatment for someone that's specific to their needs. So in the future, if we use digital mental health as the example, what I might need for my anxiety diagnosis in terms of how the app performs and functions for me could be very different to what it might look like for you. So I think that's probably one of the greatest opportunities that we have in the mental health space with in the context of artificial intelligence, is tailoring treatments very specifically to what people's needs are. The whole big data thing as well, and the ability to be able to have artificial intelligence analyze data that comes out of apps and digital therapeutics and use that for public health intervention is also quite exciting. To me, I think that's a real great opportunity for government to get some better oversight of where services might be required out in the community or in different pockets around the country. I think that's a fantastic opportunity, and yeah, fingers crossed that gets harnessed in the near future, because I think it'll be quite transformational.
Well, that's awesome. Thank you so much, Chris. I've been dying to ask you all of these questions, and I'm really excited on this season that we are speaking to people outside of the gambling field, because there's so much that we can learn from people like yourself. And I want to just say a huge thank you for being so generous in sharing your time and your expertise. There's so much knowledge you have from your experience working in this area that everyone can gain from. So I'm really, really pleased to have been able to finally have this conversation with you. So a huge thank you.
Yeah, wonderful. Thanks so much for having me, Sally. It was a great discussion. I look forward to catching up soon.
So we might add your Winston Churchill report in the show notes so everyone can access and read that. And if people want to get in touch, is LinkedIn potentially the best place?
Yep, absolutely. Grab me on LinkedIn.
Terrific. Well, thank you, everyone. That wraps up this episode of the Technology Risk and Gambling webinar series. We have 2 more for this season, and we are concluding, of course, with Early Career Researchers Showcase, which will be aired on the 6th of November. So make sure you tune in for that, but also tune in this time next week. So thank you again, Chris. Thanks very much to the Brain and Mind Centre, and particularly TJ Santos and Harrison Shine for their production support and for hosting this webinar series. Thanks everyone for joining in.